Hi, I'm Anthony Ghosh, a consultant spinal neurosurgeon and founder of the Spine MDT. In this video, we're going to discuss laser discectomy, what it involves, what the evidence suggests about it, and I'll give you my conclusion on what I think of it. So it's primarily used to treat a condition called sciatica, which is pain radiating down your leg, so starting from the back, radiating through the buttock, back of the thigh, down the leg, caused usually by a slipped disc pinching a nerve in the spine. So in this diagram here, we have the front of the spine here, the back of the spine. These are the vertebrae, the bones that make up your spine. Between each bone, you have these soft cushions that we call discs, and from each side of the spine, a nerve leaves the spine, each nerve forming or contributing to the sciatic nerve. Think of it as a big electric cable that runs down the back of the leg. And if some of this disc material tears and herniates out, protrudes out and pinches any one of these nerves, it can cause that symptom of pain radiating down the leg. Traditional treatments of this are physiotherapy or conservative management, and that's because the majority of patients will improve within a few weeks, so that doesn't usually require any invasive treatment. If that fails, you can still have continued physiotherapy or treatments from an osteopath. There are injections to the spine where you can inject some steroid around the nerve to take away the inflammation around it, and the evidence suggests that you can get as good as a result as surgery with that, provided that you don't have any neurological deficits such as leg weakness. And then there is a traditional operation called a microdiscectomy, which is quite a minimally invasive operation that I carry out. It's carried out through a very small incision in the lower back under a general anaesthetic. And under the microscope, we just shave away this little disc fragment here so that we can visually see that the nerve is decompressed. And that usually gives an instant alleviation of the pain with a fairly quick recovery. Laser discectomy involves passing a needle, a special type of needle, through the skin. So this diagram is a cross section of the spine. So this is the back of the spine, this is the front, and these are the sides. This opening here is the spinal canal through which all the nerves run, and this grey area is the disc, and this bit here is the bit that's herniated. So the idea is you pass this needle through the skin into the spine, and with laser technology you burn a type of vacuum into this disc space, and that vacuum causes a kind of suction effect, pulling this disc back off of the nerve. Now, even though the surgery I described, the microdiscectomy, is a minimally invasive procedure, this sounds more appealing, the laser discectomy, as it appears to be less invasive. The trouble is, in order for this vacuum effect to suck the disc back in, that disc fragment has to be quite soft for the force of the vacuum to overcome that rigidity of the disc. And it's difficult to predict that on scan. So the procedure relies on x-rays to know that your needle is in the right place, so you don't get a direct view of the nerve or the disc like you would with a microdiscectomy, where you see the nerve and the disc directly under the microscope. And whilst microdiscectomy is strictly carried out by surgeons, the trouble with the laser discectomy is also carried out by non-surgeons such as pain specialists or even radiologists as well as surgeons. This study here, carried out by our colleagues in the Netherlands, compared two groups of patients, both groups with sciatica caused by nerve compression from a disc fragment. One group underwent laser discectomy, the other group underwent a traditional open microdiscectomy, and then they were followed up for, I believe, up to 2 years. And what they found was similar results in the two groups. In terms of those that did well had the same pain scores, but about 52%, about half of those that underwent the laser discectomy needed a repeat procedure, i.e. open surgery, to deal with the ongoing pain or failed laser discectomy. So based on this, I don't advise laser discectomy for my patients. The protocol I follow is we try some conservative treatments in the first few weeks, possibly with a physiotherapist or an osteopath I work with. If that fails, I try an injection, because there is evidence that that can give you as good as a result as surgery, and it's actually less invasive than a percutaneous laser discectomy. And if that fails, then I do a microdiscectomy, which again is a very minimally invasive procedure and gives a definitive result because you can visually see that the nerve is decompressed. Please check out the link below that describes microdiscectomy surgery. If you found this video helpful, please click like and subscribe to the channel, and please visit us at spinemdt.com to see how we can help you. Thank you.